Good morning. Today we'll be talking about universal healthcare coverage, UHC, which is something that is spoken about often, particularly in the press, but the details of which many people are unclear about. Good morning, Dr. Ajayi. It's a pleasure to have you with us on the program again.
Good morning, Dr. Pamela. Thank you very much for inviting me. It's been a long time since I've received an invitation, so I'm honored to be here. It's nice to be remembered.
Thank you. So today we're going to be talking about towards UHC. So what is UHC and why is it something that we as a nation should be striving towards?
Well, universal healthcare, in very simple terms, means that everybody in the country has a right to affordable healthcare that of the right quality and that is accessible, within where they live. Basically, this is on the back of the declaration that healthcare is a universal human right. And every country has a responsibility to strive to make sure that every member of that country has access to healthcare. Because without healthcare, it's very difficult to drive productivity. People who are unwell, who have no access to treatment, it's very difficult for them to be a productive member of society. So healthcare is essential. And so universal healthcare is just that concept that says, well, how far as a country are we working towards attainment of those three ideals, which is quality, affordability, and accessibility.
So how are we doing as a nation? And what are the things that we could do to enable us to get there faster?
Well, I think if we can spend some time taking each of the three elements and say what can we do to improve it. If we start with the one that is obvious, which is how do we finance healthcare? We know the challenges we've had as a country in driving the National Health Insurance Scheme, which is now the Insurance Act. Less than 10% of Nigerians are insured. And we could start asking questions about how is that and what can we do about it. And I don't think we should really spend too much time on dissecting what the problems are. But if we look forward and say, well, how do we fix it? I think the key issue is where do we get funding from? As I speak, the Health Act talks about the Basic Healthcare Fund, the Vulnerable People's Fund. These are ideals that we're still looking for implementation. So it's about finding money. It's about making sure the money is properly managed and is making sure that it's properly distributed. So my thinking is, yes, fine. We're looking for funding from federal workers to bolster the fund. And there's also private sector. Yeah, we need to be innovative in terms of how to look at managing health insurance. The law, the new act says that it's not compulsory for every Nigerian to be a member of the health insurance scheme. And I think this is a good step forward. Now, how do we achieve that in reality? Is it going to be through taxation? We need to improve our taxation structures to ensure that we have, a large proportion of our economy is the informal sector. So how do we bring the informal sector in and track the funding within the informal sector to bolster up the insurance amount of money available? And I think one of the things that I believe in is that if you look at the health budget for Nigeria, it's a lot of it is going towards running hospitals, of which about 60 to 70% is on recurrent expenditure of paying staff, etc. So I keep thinking to myself that what if we came up with a plan to concession all government hospitals to charitable trusts, and charitable because we don't want to see them as profit making to the detriment of the people, but that we're looking at sustainable financing, and so that we're looking at a very marginal cost to access these hospitals. So if the government were able to think of doing something like that, I kept thinking that there would be a lot of money available to bolster the fledgling insurance funding system. And if you can think about that on a state-by-state level, where each state really pays attention to providing some kind of private, some kind of state funding structure, supported both by their healthcare funding that's diverted from the hospitals, improved taxation, and then looking at government allocation from the basic healthcare fund and the vulnerable people's fund. If we can do things like this, there will be enough money available to provide at least basic healthcare. We cannot layer on top of this private health insurance, so the HMOs, so people who are working, most companies are paying some fees to the HMOs. So if we layer some sort of co-payments on this, we can work towards improving the insurance infrastructure that's available. It just requires a different kind of thinking. So that's the affordability. Please.
Can I just ask a bit more about these charitable trusts? Because a lot of people, I mean, you say concession out healthcare, but a lot of people are very passionate and they, you know, they want to hold on to the fact that the government is paying for their healthcare, and they think if you send it out, if anybody in the private sector gets hold of it, it's going to become more expensive. It's going to become more inaccessible. I mean, has this kind of concessioning to healthcare trusts, does that work in other parts of the world?
Oh, absolutely. I mean, it's what happened in the NHS in the UK, and you'll be surprised to hear that the vast majority of hospital beds in America, in North America, very few are owned by the government. The vast majority are owned either by for-profit organizations and the large proportion by not-for-profit organizations. And the whole concept of not-for-profit means that you can go to development banks, you can get some financing, and there has to be a very clear negotiation with the government in terms of what the tariff structure will be. Make sure that it allows the hospital to be sustainable, but at the same time, the people get cards and those cards pay for their treatment. So people will get treatment, hospitals will be sustainable, the government gets the goodwill that is providing a social service, and with this kind of structure, government can put regulatory support around it to ensure that the amount of infrastructure that is being deployed meets the quality requirements of healthcare provision. So I think it's a way. It is that, I mean, you know, we look at our healthcare situations and we talk about the challenges every day. I think we need to start to think out of the box in terms of how do we address this very difficult situation. And I think by looking at these kind of approaches, yeah, they're new, and we still have to debate and understand exactly what the issues are. But I think at a conceptual level, I think it's the way forward. Thank you.
Thank you. So after affordability, I think you were going to go on to accessibility.
Yeah, I mean,
breaking down.
Yeah, so I mean, the you know, affordability is one, and let me talk about quality before I talk about affordability. I mean, what does quality mean? Quality just means that the healthcare is fit for purpose. And what we define by is fit for purpose, the first is that it is safe. No one, you know, level of complications are going to be low. People who go in for treatment are not going to get damaged by other things. Second, it has to be effective. So if you go in for an operation, the operation must provide it must relieve you of whatever suffering that you have. And the third is that it must be responsive to the people, and there must be a high level of care. Now, we have to look at our current healthcare system and say, how well do we meet these needs? And there's a lot of work for us to do to be able to audit them, because the key point is effectiveness, because if healthcare is not going to be effective in treating, if you have a urinary tract infection and you're not going to get well from going to a hospital, because number one, the level of laboratory testing that they're going to offer you is poor, it's not going to pick up the bugs that is causing the infection because they're not running quality systems, or the sensitivity is not going to put you on the right antibiotics, then that is not healthcare. That's just somebody having a go at it. And I think the need for us to really put these regulatory frameworks in place to ensure that we can provide the right level of infrastructure to ensure that we can meet the needs of the people. That's what quality is really all about. So we must meet standards. And the second question, of course, is who defines these standards? There are many standards that have already been defined by international organizations. In hospitals, we have JCI, we have Accreditation Canada, like safe care, and a lot of others. Now, what is important is that before you open a medical institution, you need to meet certain standards. And someone needs to come and tick that, yes, you've met those standards. So, and that is how we move towards providing quality healthcare. Otherwise, we'll continue where we're focused on just the input, have a room, have an equipment, and try your best. I think quality is all about the input. Sorry.
Yes, one of the things that you had spoken of before was the issue of defining a hospital. What do you mean by defining a hospital? And and how does that play a role in terms of quality and quality care?
Well, I think currently what happens in Nigeria is that to set up a hospital, you need your medical degree or not, because you need to register a company with the company Corporate Affairs Commission, and then you build a hospital. Then FEMA in Lagos State comes and registers your hospital. But I think if you're focused from a strategic point of view on safety, the first thing is to look at the different activities the hospital is going to carry out and break them down into one by one. So, for example, if you're going to do diagnostics, then you must have a system that ensures that the numbers that comes out of your machine are correct. Okay, if you're going to do appendicectomies, then you need to be able to do safe appendicectomies. You must have an anesthetic machine that is of a certain standard. Your surgeons who are going to work there must have the required training, and they must have a demonstration of the competence to be able to carry out the procedures. And then you must monitor their output. How many patients do they operate on, and what is the effectiveness of the surgery? And then you can get a tick for you can do appendix well. Then you can layer it on like that. How well are you at delivering babies? How well are you at managing diabetes? So once you're able to get that real focus on exactly what we're doing, then we can now start to define standards of input, standard in terms of the process, what are we doing, and then what is the outcome? And it's a lot of work. And unless we do this, because if you look at maternity services, for example, people argue that you should not deliver babies in any building where you don't have a obstetrician and gynecologist spending 24/7, an anesthetist there 24/7. Our blood bank must be there so that the woman bleeds, has access to blood. They must have, some people now say if you deliver the baby and the baby needs resuscitation, then you must also have a neonatal intensive care unit. If you're having that, then you must have neonatologists, on the ground. So when you start to think like that this is the infrastructure that I need to deploy before we can safely deliver a woman in this building, then the definition of a hospital starts to change. And we also can't have many of them. And that brings me to the other concept, which is accessibility.
Thank you, Dr. Ajayi. You're about to talk to us about accessibility, the third arm of universal healthcare coverage.
Yes, thank you. I mean, I think because healthcare in Nigeria is generally led by doctors who want to practice their profession, we tend to have hospitals built where they want to build them. And so there may be more hospitals in Victoria Island, for example, there is in Aja, and the people in VI become overserviced and ones in Aja underserviced. So the concept of certificate of need, the first thing is to understand that I think 80% to 90% of healthcare requirements can be met on an outpatient basis. There are very, very few requirements that need a hospital. Therefore, we need fewer hospitals and we need more outpatient clinics. And a certificate of need basically says that, if the government may decide that each local government requires a primary care center, in which case, from a private sector point of view, there are regulatory requirements to be met. And if you're able to meet that requirement, then you are the provider for that area. Now, the advantage of this, number one, is that it protects your investments, because a certificate of need means that, number one, there is a need for a service in the area. Number two, you can technically meet that requirement. Number three, you can meet the regulatory requirements. And number four, you have the financial muscle to be able to carry this out. And once the government has given you a certificate, then you look after the patients in that area. The detractors obviously argue that it creates a monopoly, and I agree that it does. But I think with the developmental stage of the healthcare system in Nigeria, we need to protect people making investments. So, for example, we can see now that there are a lot of big hospitals coming up. Now, a big hospital like Evercare, let me name that one as an example. It's a fantastic opportunity for us to really transform healthcare. But we need to make it work. And it's not going to work by just leaving it to market forces. You know, Evercare, to my opinion, should be the only hospital in that area. And all other hospitals should feed into it. Now, how do we create a regulatory framework that says, well, these guys have put significant investment on the table. They've created a world-class hospital. How do we make sure that it is financially viable? It's only through regulation. And today in Nigeria, where market forces is what drives our healthcare purchasing behavior. And I think we're not ready for that. At the moment, we need to go into some more control.
The issue is a lot of people say, you know what? Evercare is situated in a place where people can pay for it. We too want to be there. Why would I be in Aja when, you know, I could be in VI or Lekki where I can have customers who can pay for my services? Which comes first, the chicken or the egg, the payment of the hospital? How do we ensure that good hospitals go to areas that perhaps are not as wealthy?
Well, there are two issues that I need to address in the question you've asked. The first is that we always confuse a hospital and a doctor. They're two different things. A hospital, a doctor is a professional who is providing his services, and you cannot introduce any monopoly there. But a hospital is infrastructure. Okay, so where infrastructure is concerned, it costs the same to put a hospital in Ajah, and it costs the same to put a hospital in Lekki, because the bricks are the same, the ultrasound scanner scores the same. So anybody who feels they have the financial muscle to put that hospital in there because there are enough patients that will pay for it, I think a certificate of need protects them and ensure that that investment is made. Now, the doctor in Ajah therefore has a hospital to refer his patients to. He can continue with his practice in Ajah, but he now has a hospital in Ajah that he can refer to. So the certificate of need is about infrastructure, not about the profession. And I think it's important to make that distinction. So the certificate of need allocates healthcare infrastructure across the city and ensures that everywhere is covered. Now, doctors can now, it's a platform. Doctors can now plug into that platform and earn their own outpatients or professional fees without any interference from anybody. So they're two separate things, and I think if we start to break them up like that, it's easier to understand. So we're not talking about monopolies of medical practice. We're talking about monopoly of infrastructure, and I think it's very different. Thank you.
Oh, thank you. Now, you've written a lot of LinkedIn articles recently about these various topics, and one of the topics that seems to relate to this is the whole issue of consolidation. It also seems quite controversial. Now, bringing to bear your private sector experience, your public sector experience, I mean, how would you expect this to work?
Well, I think it's going back to the point I made. I think we need to focus on infrastructure and separate that from the practice. We need hospitals all across the city. At the moment, what we're doing is every doctor is building a hospital, and there are many of this on their pharma website. I think there are 2,500 hospitals in Lagos. We don't need that many hospitals in Lagos. We need we need like 20 or 25 good hospitals in Lagos. So if we say, okay, fine, before you can get a license for a hospital, you need to have this level of infrastructure. And we know that this level of infrastructure is going to cost you so much. We can put a share capital ceiling on it to say before you get a license, get a hospital, you need to, number one, show that you have the financial muscle to be able to build the hospital. And if you build a good hospital in Nigeria that meets the needs of the people in Nigeria, then you should make your money back from doing that. That's all consolidation means. Because currently, every doctor is building a hospital. And you know, these hospitals, a lot of them are a flat where, you know, or even a house where the doctor hires, turns the kitchen into the operating theater. The corridors are not wide enough for emergency beds. They don't have a lift. So some hospitals, the operating theater is on the ground floor. The admitting rooms are upstairs. So you have to carry a patient upstairs after the operation. This is not healthcare. I mean, not in this day and age. So we need to start moving into a space where we put these regulatory structures in place and we build a proper hospital. And if we do that, then it should be protected. That's what certificate of need is all about. Like I said, there are pros and cons. And some people, I mean, you know, there's a big argument in America, for example, that the certificate of need creates monopolies and only the established players keep getting bigger and they increase the barrier of entry for anybody else to play in the field. It's a fair point in a regulated space and very developed country like America. But here in Nigeria, where we're just starting, I think certificate of needs and that regulatory, you know, control of the market, I think is absolutely important. Thank you very much.
You know, you've talked about the consolidation and all that, but we still haven't explained accessibility. I'll explain what I mean by that. You see, where there's a certificate of need, most probably people who want to build infrastructure will go and gravitate towards the wealthier areas. How do we ensure, you know, somewhere, you know, outside Ekwe has the required support? How do we ensure that, you know, within Ajegunle access, that there is that kind of support? How do we, in terms of the third leg you were talking about, accessibility, ensure that people can get the kind of care they need when they need it?
I think it's all about, you know, anybody who, anywhere, any place where you can make money will attract investment. So if we have a robust and effective insurance system, as I suggested earlier, by doing those things, so that everybody in Ekpe or everybody in Ajegunle has a card, and that card provides them access because the hospital will get paid for seeing these patients. A certificate of need will put a good hospital in that area, in which case the people are receiving healthcare. See, currently we're using market forces so that only people who are wealthy can get healthcare. That's not right. I mean, you know, everybody should have access to healthcare. So the people in Nigeria, you know, if they get our insurance right and put a card in every family's hands or a biometric system, whatever it is we want to use, but somebody must pay for their healthcare. And it's a responsibility of the government to ensure that they do this. And if we can put co-payments, if we like, we can slice and dice it in any way that we want. But they must be able to pay for their healthcare. So that it's no longer about focusing on the rich areas. Every part of the country will be covered.
Oh, no, unfortunately, time is fast spent. I mean, there's a whole lot that I wanted to talk about, particularly the issue of the brain drain and how does this fit into universal health coverage when we don't even have staff. We'll just have a couple of minutes left. In your wrap up, in our last words to our listeners, how can you address that issue?
Well, I mean, people are going, you know, brain drain is being driven by people's desire for greener pastures. We have to stop this place looking like a desert and make it green. That's the only way. So if Nigeria is green, then the pastures are here. And it's as simple as that. The health insurance system in Nigeria needs to look at its tariffs. insurance tariffs in Nigeria are ridiculous. It's almost as if, even at the private sector with HMO, the amount of money that a doctor gets paid for doing his work is enough to fuel brain drain. So we have to pay doctors better for the work that they do. And if we're able to do that, and the pastures agreeing, why should they travel? It's very simple, to my own opinion. We have to look at ways of making sure medical staff are better paid for the work they do in Nigeria. Thank you.
Thank you very much. Thank you for watching. Please like, share, and subscribe for new video updates.